Hello everybody, my name is Farai Chipunza and I'm a physiotherapy student studying at Vincent Paul University in Poland. So right here I'm documenting my journey as I am doing my masters for you guys and for also my future employers so they can see how I work with people that I come across every single day. So our patient today is a 23-year-old male who is a student and has no children at the moment. He hurt himself in the gym while using the adductor machine. In his own words, he said after concentrically working the adductors, bringing the legs together, when now releasing the legs, he felt the femur moving outwards and the tibia moving inwards. After this unnatural movement, there was pain straight after, so he stopped the exercises and packed his stuff and went back home. So in walking back home, the pain was still there and he was walking slowly to manage it. We managed to have the first session of physiotherapy 2 days after the incident, and his pain had reduced from an 8 to about a 5 out of 10. So I did the objective assessment, checking the range of motion of the joints from the waist down, and everything was okay. The limitation in range was only because of muscle stiffness and soreness from the gym. We're now moving to the special tests, the anterior drawer test, posterior drawer test, the leg sign, the MCL and LCL tests were all negative. But when now testing the plica, I found that it was irritated and reproduced the pain. I started with palpation and I saw that the muscle was still tender from the exercises at the gym. And in addition to the plica, the medial patellar tendon was also irritated. So I did friction massage and compression to calm down the tender spots. I did deep tissue massage for both quadriceps to loosen them up, in turn reducing the pull on the patellar tendon. And lastly, for quadriceps, we did some scraping and we retested and the pain had significantly gone down. And since we were devoid of time, to provide momentary relief for the hamstrings and the calves, I did acupressure therapy, focusing on strands of tension. In the second session, we started with testing and he said the pain had dropped down to a 2 or 3 out of 10, showing that we were on the right track. And upon palpation, the pain was also a 2 out of 10. So I made no changes to the treatment plan that I had before, deep tissue massage for the patellar tendon and the plica. And I found that the little bumps that were around the area had disappeared. And I did deep tissue massage for both quadriceps, focusing mostly on the vastus medialis and the vastus lateralis, and also incorporating acupressure therapy using my elbow. When moving on to the hamstrings, I saw that the muscle heads were glued together and I had to separate them, and I had to use my elbow to reduce the strands of tension. And for the calves, it was the same story, with the right one being the most problematic. The heads were also glued together and I had to separate them using my elbow. And on the right side, the medial gastrocnemius was tender, and so was the medial side of the popliteal muscle, which is found at the back of the knee. So I did deep tissue massage to fix this and conclude the second session. During the third session, the pain was gone, meaning the therapy coupled with some rest was very effective. So we worked on a completely different problem. He said he was feeling sore and stiffness from the gym. I palpated and saw that he had tender spots in his trapezius, and also the left erector spinae were more hypertoned compared to the right. So for therapy, what I did was deep tissue massage, focusing on these tender spots, and his right trapezius was more problematic compared to the left. Then I did scraping and vacuum cupping to break down the adhesions in the fascia. For exercises, we did a passive stretch for the trapezius, also incorporating post-isometric relaxation method to relax it. And to improve stability in the knee, we did isometric adduction at the 0 point and then with the hip abducted. On the fourth session, he was now back in the gym and he had just done a leg day the day before, so his calves were the most sore of all the leg muscles. So I did deep tissue massage, focusing mostly on the medial gastro, which was tender in both sides, with also the alteration of bending the knee to loosen up the gastrocnemius. And in the right side, the medial side of the popliteal muscle was still in pain. And then I also did acupressure therapy with mobilization, putting pressure on the strand of tension and then plantar flexing and dorsiflexing the ankle. And to provide relief for the other muscle groups, I did acupressure therapy for the hamstrings and the quadriceps. And to build stability in the knee, we continued with our exercise, doing isometric adduction with hip abducted and with hip abducted and flexed. In the fifth session, we directed our focus back to the back. I started with palpation and there were still trigger points in the trapezius and the left erector spinae was still hypertoned. Then I checked the superficial fascia and released it by going towards the barrier and sometimes by gliding in different directions. And we're now testing the integrity of the layers of fascia. I saw that the fascia in the lower back, the layers were not gliding properly and one position was stuck. So I used Kibler folds to unglue the layers of fascia. Then I did deep tissue massage, focusing on the tender spots that I noticed earlier in palpation. And this right trapezius was more stiff compared to the left. Then we did a passive stretch for the trapezius, also incorporating post-isometric relaxation to further relax and lengthen the muscle fibers. Then we finished the session with scraping and vacuum cupping, putting more emphasis on the places where the fascia was glued. So this was the overview of all the 5 sessions that I had with the patient. As you can see, it was not a very serious injury, but the pain scale of an 8 at first might have indicated otherwise. But upon future testing, we saw that everything was okay. And with therapy and rest, the problem resolved itself. So in the next phases of physiotherapy, we'll be trying to rebuild the stability in the knee so that we don't re-injure the knee again. And if you have made it this far into the video, I would like to thank you. I appreciate it so much. Can you please leave a like, comment, and subscribe? See you in the next one.